Good afternoon, everyone. Happy Monday. It's the last Monday, well, not the last Monday, but like you won't have to be here next Monday, right? It's our last week before our break. I'm excited. I hope you guys are excited. But I would like to gently remind you that you will have an exam the week you come back from break. 2 more weeks of material and review, and then a final. So it comes up really fast. So while you should all totally enjoy your vacation and take a break and get some rest, please don't jettison all of your physiology knowledge over that week, because it's going to be a lot of cramming when you come back if you do. Okay, so maybe just run a few Anki cards or something on break. Explain physiological processes to your family over Thanksgiving dinner. In that vein, in terms of studying though, I did want to say that I have posted the blank exams on Canvas. So if you go to exam info, on the left-hand side, all of the exam names are now links to the PDF files that contain the blank questions for you to use. Okay. So this is going to be digestion. We're going to run it the same way we did Friday. Oh, there was a question in the back, sorry. Will the lecture slides be posted? Is that what you asked? Okay. Yes, I will make sure that the review portion of this is posted, especially since we are not going to get to it at all. I guarantee you we didn't get through the questions last. Although it will be a little faster this time, because I'm going to skip a few, because I discovered that there's a few I'm not sure what he's getting at. So I want to make sure that I get the answers to those before I confuse you guys. So that's why I'll be skipping past a few. But I will post the review portion. Which means getting past all of that. Okay. So Bella's on a leisurely hike, and suddenly this absolutely adorable dog starts chasing her, and for some reason she panics and runs. Which of the following changes will occur in Bella's body? Will her digestive and urinary functions increase, her heart rate increase, her blood circulation rate increase, her epiglottis constrict, or her pupils dilate? And we'll answer each of these as true, false. So if she is running scared from a dog, would her digestive, I should say as a statement, her digestive and urinary functions will increase, true or false? Crap. Okay, most of you are saying false. That's great, right? Digestive functions, urinary functions, those are all going to be part of the parasympathetic rest and digest system. If she's running from a dog, she's activated her sympathetic system. She's now in fight or flight. And so all of the digestive and urinary functions will decrease, not increase. Give me a second just to clear these responses, though. So I often get asked about that. And people will say, you know, if your urinary functions are decreasing when you're in sympathetic mode, why do people who are scared sometimes pee themselves? And the answer is that's not a urinary function. That's not creating urine. That's urine that was already stored in your bladder, and now your sphincter has released. Okay, so that's why you can still pee even though your urinary system has downgraded. And still waiting. Any other questions about that one question we covered? No. All right, let's just take like a poll. Would Bella's heart rate increase? Yes? No? Everybody says yes? Fantastic. Okay, that is sympathetic drive. We talked about that with cardio. You're going to have norepinephrine that gets released onto your beta-1 receptors on the heart. It's going to increase your heart rate. It's going to increase contractility. Let's see if I can read any of the rest. Shoot. What about blood flow or what about flow rate or blood circulation rate? You expect it to increase, decrease? I'm getting a lot of increases. That's tricky. It is. I'll just preface this before I tell you you're wrong. That's a tricky question. Flow rate is very complex. It's going to go up in some places, it's going to go down in some. You can't say that the sympathetic is decreasing it or increasing it. So that one would be false, sorry. Yeah. How about pupils? Her pupils dilate. True or false? Seeing kind of both. It's a mixed bag. Okay, do we know what dilate means? To open up, yeah. All right, so if you're in sympathetic drive and you're running away from something or you think there's danger to your life, would you want to open your eyes up so that you can see more of the world around you or close them down so that you have a higher visual acuity? Generally speaking, actually open, yeah. It's more important just to recognize if there's a danger coming, not so much exactly what that danger is wearing or, particular features of it, just that it's there. So dilating happens in sympathetic and you go back to normal in parasympathetic. Oh, finally, good Lord. All right. So Professor Christian caught Joni dozing off and shocked the sleeping student. I'm really hoping Professor Christian did not literally shock them. I'm thinking maybe just startled them. Indicate if the following biological processes were likely occurring in the shocked student's body with true or false. So, would Joni have increased attentiveness? Most of you say true. Yes. So again, if you're going to startle someone, you are now going to activate the sympathetic drive, and that will increase their attention. What about increasing gastric motility? Most are saying false, and that is true. False is correct. We'll put it that way. So gastric motility, anything to do with gastric is going to be parasympathetic. If you're in sympathetic mode, you would not be increasing your gastric motility. You would actually decrease it. Okay, increased, we're skipping that one. Increased saliva production. False. Wonderful. Good job. So saliva production, again, that's a component of the parasympathetic system, rest and digest. And if you're in sympathetic, you would actually decrease. I like to say that's why you have dry mouth when your sympathetic drive is activated. So like if you have to lecture in front of students and your sympathetic kicks in, you get dry mouth and you have to keep your water bottle next to you and like suck on it all the time. Yeah. Okay, what about sweat production? Is Joni, I think it was, going to have increased sweat production, true or false? True. Okay, sympathetic is going to increase activity in the body. You're going to need more energy produced to power your muscles for either the fight or the flight. And when you do so, you will create heat as a byproduct. When you have that much heat, then you need to try to cool your body off by sweating. Okay, so you would definitely increase your sweat production if you're running from something. All right, so it's Friday night. Adam finished all his homework for the week. He decides to celebrate by going out for a nice dinner with his friends. Indicate true or false for whether the following is occurring in his body as he enjoys the meal. Salivary amylase breaks down triglycerides in the mouth. True or false? You know, this section is like half the size of the previous one, and I'm getting more responses from you, so thank you for being so engaged. All right, kind of a split, but mostly true. Anyone who said true want to tell me why? I will try to be psychic here and assume that you're thinking, well, he's resting, he's eating, it's parasympathetic, that's rest and digest. So wouldn't salivary enzymes increase? It would, but amylase doesn't work on triglycerides. Amylase works on carbohydrates. You would need a lipase to be able to break down a triglyceride. So that was a trick question. I didn't write it, I'm sorry. Okay, would bronchial tubes constrict to cause faster airflow? Okay, true? Anyone think that's true? Anyone think it's false? False is right. Okay, he's resting. He doesn't need increased airflow. Blood flow in the digestive tract increases. True or false? True. Okay, you need that blood flow to help all of your digestive functions, and since you're in parasympathetic, you are increasing digestive functions. So, would secretions by accessory organs be inhibited? False. Okay, so accessory organs are things like pancreas and gallbladder. They are involved in the digestive system. So if you are in parasympathetic, you would not want to inhibit those accessory organs. In fact, you would actually stimulate them because you need them as part of the digestive process. The delicious aroma causes activation of the vagus nerve. True or false? True. So the vagus nerve is the nerve that is carrying most of the parasympathetic fibers. If you are in rest and digest mode, then you are going to be stimulating the vagus nerve, and that is then going to feed signals to all the different parts of the parasympathetic system to increase things like saliva and gastric motility and all that kind of stuff. And just smelling food can actually activate that vagus nerve. All right, so questions up to there? Yeah? Where is the vagus nerve? Okay, vagus means the wanderer. It's everywhere. It starts, which cranial, oh, Kiana's not up there. It's cranial nerve 10. I can't believe I actually forgot that for a second. So it's going to start like off your brainstem, and then it literally feeds all over the body. All right, if you do not eat for 4 hours and then you see a waiter bringing out your favorite meal, it would result in the increase in the secretion of, and we'll go through each one, but is it alkaline mucus, ghrelin, lysozymes, salivary protease, or secretin? So, would seeing and smelling a meal that you are dying for because you haven't eaten in 4 hours, is that going to increase secretion of alkaline mucus? It's like split. It's true. It would increase alkaline mucus. Okay, so you need alkaline mucus as part of the digestive process. And so if you smell food, you're going to start stimulating more of your enzymes and components of your digestive process in preparation for that food coming in. Okay, so you would already increase your alkaline mucus. What about ghrelin? Would you increase secretion of ghrelin? Yeah, question.
Can you explain the purpose of alkaline mucus?
Sure. So it's mucus, really is what it is. And it's to protect your digestive tract, primarily your stomach, from the acid that you use. So the acid's really important for killing microbes and helping to activate and denature proteins. But it will also eat right through your stomach lining and give you ulcers and cause additional problems if you don't maintain some kind of mucus layer to protect it. So we have a lot of mucus in that stomach for that purpose. And if we're going to eat something, we're going to increase our amount of acid that we release, and so we would also want to increase our secretion of mucus to help protect. Okay, so what are we saying about ghrelin? Most of you are saying true, it would increase. I know, it's a digestive enzyme, and I said we're going to increase our enzymes, right? That's actually not an enzyme, it's a hormone. Ghrelin is different because ghrelin is what I think of as a little gremlin. It's what comes out when you're hungry and makes you go, oh my God, I want food right now. Okay, so this is the stimulus that tells your body and your brain that you need to eat. You're hungry. So put some food in your mouth, like now. Okay. If you are smelling, wait a minute, what did I just say? Did I tell you that true was not true? Yeah. Sorry. There's another question in here. I just gave away the second question, but in this case, yes, it's true. Because if you're smelling food but you haven't eaten it yet, it's been 4 hours, then ghrelin is going to be very high. Ghrelin is going nuts. Like, I am so hungry and I can smell it. It's right there. Give it to me. So you would definitely have an increase in ghrelin if you haven't eaten and you smell the food. Apologies for the confusion. Any questions? Any clarification needed there?
Wait, so if digestive increasing, ghrelin has to increase as well?
No. If you smell food, the ghrelin would increase. If you actually ate the food, ghrelin would be calm. It'd be like, okay, I'm happy now, and it would shut down. There was another, nope, okay. What about lysozymes? Increase, true or false? Half and half. Who knows what a lysozyme is? Anyone? Yeah.
I want to say it breaks down enzymes.
Okay, so lysosomal enzymes, you're thinking. Lysosomal proteins? Yeah, that's a great connection to make. In this case, though, a lysozyme is an enzyme that's in your saliva, and it will actually help to prevent, not prevent, but it will help to, what's the word, protect against microbes, pathogens. Okay, so this is going to attack things like bacteria and viruses and try to break them down so that you're not infecting yourself when you eat. Right? So lysozymes in your saliva. With that in mind, would you expect lysozymes to increase if you smell food? Who says true? They'd increase. Who says false? Sorry. You just don't know. They would increase because, you know, your body thinks you're about to put food in your mouth. It needs to have the enzymes to deal with it, including lysozymes that will protect against any kind of infection. So far they've all been true. We're increased, right? What was the first one? Lysozymes increase, ghrelin increases. What was the first one? Mucus increases. Thank you. All right, what about the secretion of salivary protease? Okay, and based on the fact that I have just been like hitting you over the head with this idea that we're increasing all of these enzymes, you all said yes. This one's a trick question though, because there is no salivary protease. We do not break down protein in our mouth. That doesn't start till the stomach. So we've got salivary lipase, we've got salivary amylase, but there's no such thing as salivary protease. So that's false just because it's not true. I'm not a fan of trick questions like that personally, but what about the secretion of secretin? I will tell you right now that's a real thing. So, does secretin increase? True, that's correct. Secretin is actually a small intestine hormone, but just like all of the other digestive enzymes and hormones, or most of the hormones, it will increase because this is going to be important for triggering the release of bicarbonate from the pancreas in order to buffer the acidic chyme when it gets there. So it wants to start prepping to have that ready. Okay, gastric emptying. This is a tricky concept, I think, sometimes. Some of this is just memorization. Some of this you can kind of logic out. But if we're talking about delaying gastric emptying, meaning that we are going to keep our food in our stomach longer, and we will feel full longer because of it, which of the following factors will help with that decrease in gastric emptying? Decreased gastric pressure, salty meal, low fat meal, incomplete mastication, or low fiber diet. So starting with decreased gastric pressure. If you decrease your gastric pressure, do you delay the gastric emptying? Most said true, and that's correct. All right, the way I would logic this one out is to think the higher the pressure on your stomach, the more the stomach is like, boy, I've got to get this stuff moving, right? I'm getting so big and full, I need to move this out of here. So if you have high pressure, you have high gastric emptying, but if you have low pressure, you have lower gastric emptying. What about a salty meal? Will that delay your gastric emptying? Okay, most said false, and that's actually true. So high salt meals mean that you are going to have a high osmolality. You have a high solute concentration per solution, and that's going to be a factor in decreasing your gastric emptying. Don't have a particularly good way of logicking that one out, except maybe if you just think about, like if you have a high osmolality, it would suggest you have more particles in there that need to be broken down, and so your stomach has to take more time doing that, and therefore higher salt content, more time in the stomach, delay in emptying. All right. Okay, what about a low-fat meal? False. Good job. All right, so if you have high fat content, it's going to increase your viscosity, okay, because fat is more viscous than water, and high viscosity will actually decrease your gastric emptying. So a low fat diet is going to do the opposite. If you don't have a lot of fat, you have lower viscosity, you will actually increase your gastric emptying. So this is a false. The low fat will not decrease or delay gastric emptying. Incomplete mastication, meaning you're not chewing your food very well. Okay, so we're shoving food in our mouth in between our classes, and we're just like eating things whole. Will this increase or decrease? Let me rephrase that. Will this delay our gastric emptying or decrease the gastric emptying? Most people are saying that it's true, and that's correct. Okay, so this is the idea that you are going to have larger particle size. And again, I would say if you're logicking this out, think about if it's bigger, it's going to take more time to break down, so your stomach has to work on it longer. So it's going to keep it longer. Okay. What about low fiber? Would you reduce or delay your gastric emptying by eating a low fiber diet? Bless you. Okay, most people are saying false. Would you delay? That's correct. So this goes back to viscosity again. When we have high fiber in our diet, we can increase the viscosity, we can thicken the food, and therefore your stomach's going to take longer to work on it. That's why eating a high fiber diet actually makes you feel full longer. So any questions on gastric emptying? Okay, what's this one? We're skipping that one. All right. As a bolus of food enters the stomach and causes the distension, which of the following secretions decrease? Mucus, acid, ghrelin, or gastrin? Great job. Kind of gave that one away earlier, but yes. When you have food that enters your stomach, you need to start breaking it down. You need that acid. So that's definitely going to increase. To secrete more acid, you need the gastrin to stimulate it, so that increases. And then with more acid, you need more protection, so you're going to increase your mucus as well. The only one that you don't increase is ghrelin, because now it's happy. Your little gremlin has been fed, and it will actually decrease. All right, so questions on any of that? We're good. Okay. Due to a mutation, John's gastric cells do not release much acid. How does this condition affecting the intestinal phase of digestion? Decreasing secretion of CCK, decreased secretion of GIP, decreased secretion of secretin, that was a mouthful, or decreased secretion of alkaline mucus. Okay, most people said D. Let's just walk through each one of these and talk about what they are. How many people know what CCK is? A couple. Okay, so CCK is cholecystokinin. It is going to be released from eye cells in the duodenum, in the small intestine, and it will trigger the release of pancreatic enzymes. Okay, so CCK gets released when food comes in, and then it travels to the pancreas and causes the release of pancreatic lipase, pancreatic proteases like trypsin and chymotrypsin, and pancreatic amylase. Right. What about GIP? Anyone know what GIP is? Yeah? Gastric inhibitory peptide, right? Okay. Yes, because it's related to insulin, right? Yep. So that's a good way to remember it. And that comes from where? That's the stomach. That is stomach. It's gastric, yes. All right. What about secretin? We talked about that one. We said that one causes the release of bicarbonate from the pancreas to buffer chyme. So where is secretin located? Small intestine. And then alkaline mucus. Where do we typically see alkaline mucus? Kind of all over, but I'm hearing stomach majority, yeah. So we do have mucus in our throat to help move the food down. Like we said, we do have some mucus in the small intestine, but very small amounts, because typically you want to keep that very thin so that you can get food across. So the question here is, if he's not releasing much acid in the stomach, how is it going to affect intestinal phase, which means small intestine? So one of the first things you could do is probably rule out like anything that's not in the intestine. So that would rule out GIP and probably alkaline mucus, because that's really more of gastric. So then you don't have as much acid in the stomach. When you get to your duodenum, is that more likely to affect CCK releasing enzymes or secretin releasing bicarbonate to buffer acid? I don't know. If you can't change that, it doesn't matter. But it's secretin. Okay, so if you don't have as much acid, you don't need as much secretin because you don't have as much to buffer. All right. All right, a nice easy one. You don't even have to think about this one. This one should be automatic. During swallowing, what prevents food from entering the trachea? Is it the tongue, the uvula, the epiglottis, or the soft palate? Okay, epiglottis is correct. It's just anatomy, memorization. That's the big structure that blocks the trachea so that you don't, hopefully, choke on your food. All right, mastication enhances enzymatic action by increasing the blank of ingested food. Volume to surface area ratio, surface area to volume ratio, or density. Yes. Good job. Yay. This can be tricky sometimes, especially if you're not familiar with terminology or how ratios work, but whenever you're being given a ratio, the first one is the one you're referring to. Like in this case, if we say surface area to volume, we would be saying surface area increases in relation to volume, whereas the other one, volume, would be saying we're increasing volume in relation to the surface area. So it's C because as you masticate and chew it up, you create smaller bits that increases that surface area. Okay, what's a consequence of chronic purging? Decreased gastric motility, tooth decay, gastric ulcers, or acid reflux. Tooth decay. Beautiful. All right, so the things that he talked about for purging was esophageal lesions, right? So when you purge, you're bringing up chyme, it's going to be acidic, that's going to tear up your throat, it's going to eat through the enamel on your teeth. It can also cause cardiac irregularities. So those are the things you should be thinking of with chronic purging. Which of these secretions converts pepsinogen to pepsin? Ghrelin, HCl, gastrin, or intrinsic factor? Kind of all over the place. That's interesting. So I could maybe see why some people say gastrin. I'm hoping it's because you recognize that gastrin is what stimulates the release of HCl, which then converts pepsinogen to pepsin. But if we're saying what converts it, we're asking which particular enzyme is directly affecting. And in this case, it is the acid, the HCl. So acid is really good at denaturing proteins. In this case, it will also help to cleave off the inactive portion of pepsinogen so that it's active and can start breaking down proteins. So any questions on that? Okay. If you have a mutation that decreases the release of CCK, are you more likely to have an impaired fat breakdown, insulin secretion, neutralization of acidic chyme, or protein synthesis? Okay, so still some, like half and half here. At least you guys are mostly on the two duodenal enzymes. So the two that you guys need to know, CCK, or cholecystokinin, and secretin. CCK is going to cause the release of all of your enzymes. Secretin is going to buffer acids. So just remember those two. All right, so if we have a decrease in the release of CCK, then we're going to have a decrease in fat breakdown because we will not have the enzyme we need to break it down. We wouldn't have as much lipase available. Right, protein synthesis has absolutely nothing to do with this. Digestion is, catabolic. We're breaking things down, not putting them together. Insulin secretion, not really from CCK. Decreases the release of CCK. I mean, you could maybe stretch that logically and talk about very, very indirectly, but when you see a question like this, if you're thinking, well, maybe, focus more on what's the immediate action and what's directly affecting. Okay, unless it's in all of the above. And then come ask. Okay, which of the following would not be prevented by eating a high fiber diet? Constipation, diarrhea, C or hemorrhoids? Diverticulous. Diverticulosis. That's what you're saying? Oh, you're explaining to me how it's pronounced? Yeah. Thank you. Bless you. Yes. I can't. I struggle over that word. I stumble every time I try. Okay, so we're not quite sure. We're just all over the place here, but mostly saying constipation and hemorrhoids. So thinking about high fiber, what is the effect of having high fiber in your diet? I can't hear you. You can scream it out. Yeah, go ahead. It'll give bulk to your feces. That's a really important point, especially for these particular answers. So there is soluble and there's insoluble, and they have different effects, whether it's increasing viscosity or increasing bulk. But if you increase bulk, that's going to help with several of these things, right? Primarily with constipation, it'll help it move better. It'll help with C. You can pronounce it again for me if you want. What's? Thank you so much. But then, what about diarrhea? What do we say about diarrhea?
It's just really loose, watery stools, usually due to stomach balance or parasites and disorders.
Yeah, so if we have loose, watery stools, are fiber really going to help that? Is that one of the things that we talked about as a treatment? I mean, it depends on what is causing the diarrhea. You always want to find out what's actually behind it, whether it's an infection. Do you need to have some antibiotics? Is it just a food sensitivity that you have to avoid certain foods? But really, when we talk about diarrhea, we talk more about immediate treatment, which is just replacing fluids, replacing your electrolytes. But when we talked about everything else, we talked about how fiber consumption was part of the treatment. Okay, so if you take away one thing from digestion, it's eat more fiber. It solves just about everything but diarrhea, right? Okay, so any questions up to here? No? This is pretty much the same question we already had, right? I'll skip that. And that one. Okay, this one's new. One of the consequences of celiac disease is blank because colonic bacteria break down the sugars that were not digested and absorbed in the small intestines. So is one of the consequences of celiac disease bleeding, constipation, floating or bloating stools, or impaired peristalsis because the bacteria is breaking down sugars that were not digested and absorbed. Most of you are saying floating and bloating stools. So it doesn't even matter that it's celiac disease in this case, because we know celiacs can cause a lot of these symptoms. The key to this question was the idea that the bacteria is not breaking down the sugars that weren't, or I'm sorry, the bacteria is breaking down the sugars that were not previously digested, and it's not being absorbed. So we talked about how that can actually lead to the bloating of the feces. It's got that gas and excess lipids in there that will cause it to float. So any questions on that? You guys are doing great. Okay, which of the following is a disaccharidase? Let me restate that. Which of the following is a disaccharidase? Is it fructose, sucrase, maltose, or lactose? Sucrase, fantastic. How did you guys know it was sucrase? ASE, right? That's your enzymes. Anytime you see ASE, you know it's an enzyme. So if we're asking for an enzyme to break down two sugars, we need sucrase, maltase, or lactase. Okay, so which of those were actually disaccharides? Fructose, maltose, lactose.
Maltose is the disaccharide comprised of 2 glucose.
So maltose is a disaccharide with 2 glucose molecules. What about fructose?
Fructose is a monosaccharide.
Monosaccharide.
Oh wait, lactose is also a disaccharide.
It is. Okay, so let's go back to fructose for a second. Fructose is a monosaccharide, and if you combine fructose with a glucose, you get what? Sucrose. Okay, so lactose is your last one. That's a disaccharide. That's going to be galactose and glucose. All right, so remember those. That one's just kind of memorization, but we can ask you questions on those. How are we doing? Oh, we got 4 minutes. All right, one of the mechanisms to regulate low blood glucose levels is the activation of hormone-sensitive lipase. What's the most direct consequence of activating hormone-sensitive lipase? The release of fatty acids for utilization in muscles, release of epinephrine, gluconeogenesis, or release of glucocorticoids? Guys, you're thinking about this one a little longer. And you're all over the place. Okay. All right, so let's talk about this. If we have hormone-sensitive lipase, what's that tell us? What's a lipase? Enzyme, ACE, right? That's the first thing. And what's it breaking down? Lipids. Okay, so lipase will break down your lipids. And now if we just think about like what could we possibly be doing with this, let's go through each one. Release of fatty acids for utilization in muscles. Does that sound like something that you could maybe do with a lipase? I mean, fatty acids are lipids, right, or the breakdown of them, so maybe you're using the lipase to break down. And if you've got low blood glucose levels, maybe you're having to use your free fatty acids for fuel instead of glucose. So that seems like it's reasonable. What about release of epinephrine? You're going to release more epinephrine if you've got low blood glucose? That's beyond the scope of this class. But for what you guys know, think about it as epinephrine is really kind of sympathetic related. And sympathetic is going to eat through your energy resources. So maybe logically you probably wouldn't want to do that if you're low glucose already. Gluconeogenesis. If you're low on glucose, do you have a whole lot to be making new glucose from? That was the dumbest thing I've said today. And that's a low bar because I've had some real good ones. So gluconeogenesis is the creation of new glucose, right? Genesis. You do that when you're low glucose. So that might also make sense under these circumstances as well. So we'll hold on to that one and A, and we'll rule out D, right? I hope we all say glucocorticoids, like cortisol, has nothing to do with this, right? Say yes, please. Please say yes. Thank you. All right, so between A and D, if we're talking about lipase, do you think lipase is more likely to be involved or have a direct consequence on gluconeogenesis, or to have the freeing of fatty acids to be used in muscles? I'd go with A. That sounds like a great idea. Yeah. All right, let's end it there. And you'll have Dr. Michael back on Wednesday. And I think that's it. Enjoy the rest of your day.